Like, I think this is one of the hugest problems with insurance. They make it so hard to care for people. Like, they make it extremely difficult. When I take care of people in my office and I want to put them on a medication, I don't have to ask the insurance company to do it. I just put them on it. And most of the time, the medication is actually pretty inexpensive if you just pay cash for it. So there's GoodRx, there's Blink, right? But with insurance, I have to put certain things into the chart. I have to find an ICD-10 code as if that's of any value to me or the patient, right? It is of no value to me or the patient. Somebody somewhere else has to code that chart, has to look at my chart and see that it has all the elements that the insurance company needs to pay for me to take care of the patient. Whereas when they come here, it's spectacularly easy. I just do it. And I don't have 30 patients waiting in my waiting room because I have to have this huge volume of people to pay for the people that I need to get the insurance companies to pay me. I just need me. And I don't need a huge volume of people to pay me. So it is incredibly easy to take care of people if there aren't any obstacles in our way. And essentially the insurance company is just a huge obstacle to taking care of people. And it frustrates me beyond end because I still have to deal with it in the hospital. I still have to deal with the fact that if I do a CT scan and the patient's history, as far as the insurance company, means that they shouldn't get a CT scan, they will not pay for the CT scan, and they'll basically tell the patient that they have to pay for the CT scan. So the patient is being punished because I didn't put whatever it was in the chart that the insurance company wants to see. And the other thing they'll do, oh my gosh, this makes me so crazy. If the patient comes in with belly pain and I discharge them with something like innocuous, like not dangerous at all, like viral gastroenteritis, so basically the stomach flu, oftentimes the insurance company will not pay for that emergency department visit because they did not have a serious condition. How are they supposed to know? Right? They're coming to see me in the emergency department because they don't know whether or not it's serious. They're not doctors. They're not nurses. They don't know. They're coming to me because they don't know. But the insurance company is somehow thinking that they're psychic at home. They're psychic. They know what the problem is. And then they came in for nothing. No, they didn't come in for nothing. They came in for nothing because they were lying on the floor screaming in pain and bloody poo was coming out of them. Right? I'm a doctor, and I think if that was happening to me, I'd be seriously tempted to go to the emergency department, even though I know it's not that bad. So I think that it's just is so frustrating to me that they make it so difficult. And they don't have to. They just do it so they don't have to pay. And they put their entire administrative burden, particularly Medicare. Oh, I could go on forever about Medicare, right? They want to make Medicare for everybody. Oh my God, that's crazy. Medicare is killing medicine. But they want to make it something that goes on for everybody. Everybody gets Medicare. So what? All of medicine is destroyed? So that no doctors get paid, no nurses get paid, no physical therapists get paid? Honestly, like what is that? That's insane. Medicare, the reason Medicare is cheap is because they take all that administrative burden and they put it on me. So instead of taking care of my patients, again, what am I doing? I'm trying to find the right code so that Medicare will pay me to take care of the patient. Literally, so that Medicare will pay me to save the life, right? When I spend 15 minutes saving a life, which I do on a regular basis in the emergency department, me and all my team, right? We're all together working. I spend 15 minutes saving that life. I spend 30 minutes talking about saving that life in the chart so that I get paid for the 15 minutes saving the life. And here's the irony. I bill the insurance company for 45 minutes of life saving because of what they made me do. Right? That's 45 minutes of my time. That's an extra 30 minutes of doctor time that they have to pay for because they made me spend 30 minutes talking about how I spent 15 minutes saving the patient's life. Right? That is so beyond ridiculous, I can't even begin to say. It seems like certainly the amount of administrators has gone up like 90 times In the same time, physicians have maybe doubled, right? So, and nurses haven't increased that much, physical therapists haven't increased much. There's a tremendous amount of money that is going into actually not taking care of patients, right? So it's basically like an arms race, right? So the insurance company decides they're not going to pay us unless they have X, Y, and Z, right? Or they're going to pay us less for whatever it is. So then I have to document things at this level so that I can get paid the same thing I used to do for documenting at this level. So I document at this level. So then the insurance company is going to say, oh, we're only going to pay you this much if you document at that level. So then I document at this level. And it goes on like this. And I spend more and more time not actually taking care of my patients. All right, I'm down to, I used to be able to take care of easily 25, 30 patients in a 10-hour shift. No problem. With written charts. Super easy. I can now maybe take care of 17, 18 patients, and I'm going to spend a couple hours off shift writing my charts. But here, in my direct primary care clinic where there's no insurance company, it takes me about a minute to write a chart. For a new patient, it's a little bit more. It's about 8 minutes to write my chart, right? It's not hard. It's not hard. And so I think that, when people ask me what I'm passionate about, the truth is what I'm passionate about is getting insurance out of primary care, at least getting insurance out of primary care, and maybe getting insurance out of paying certainly doctors altogether if we can, because it's not useful. It's not useful. They charge too much. They put way too much administrative burden on us. And Medicare is not great. I don't care what anybody says. It's not great. There's a reason why so many doctors are declining to take Medicare now. And it's because they're not getting paid for the care they provide. And yeah, does that upset us? Because really we do want to take care of people who are over 65? Yeah, of course we want to take care of our elders. Absolutely. But I can't do it if you're not going to pay me to do it. And that's really how it's working right now. Direct primary care doctors just opt out of Medicare so they can take care of people over 65. Because I'm not kidding. If I take care of a Medicare patient, because I'm still opted in because of the emergency department, if I take care of a Medicare patient, I have to bill Medicare. I cannot see the patient for free. Otherwise, it's, again, not kidding, Medicare fraud. Even though I don't bill Medicare. So, yeah, it's an absolutely ridiculous system. So, yeah, so Luke's over here looking at me like, are you kidding me? I'm not kidding. I'm not kidding, Luke. That is exactly what happens. So, yeah, right, people, we need to get rid of insurance. We do. We certainly need to trim it down, right? There are places that it would be a good thing, but not in terms of just basic everyday care. Yeah, okay, rant over.